Good evening, good afternoon, everyone. My name is Julian Perez, and I am the Vice President of Risk Management and Regulatory Compliance at Delcorp. And I am very excited to be here today with our guest speakers, Aubé-Simmonds and Theresa Cullen. We'll be talking about practicing dental hygiene and working in a dental practice, an orthodontic clinic in the age of COVID-19. What it's been like to get back to work, some tips and tricks for coping with all of the changes, for adapting and adjusting, and just having a discussion about all the things that we've gone through in dentistry from the perspective of two hygienists. So I'll introduce my guests and they'll begin just talking a little bit about their background. So Michelle Aubé-Simmonds has 25 years of experience as a dental hygienist, a dental hygiene professor, entrepreneur, and owner of Positive Impact Dental Coaching, where she offers leadership and coaching for dental professionals. Since 1994, Michelle has been a dental hygiene department leader and IPAC officer at Southwest Dental Care in London. She is continuing education manager at Maxwell St. Thomas, where she's researcher, speaker, advisor, and IPAC leader. Her professional speaking extends to other companies such as J&J and Straumann, as well as organizations including Public Health Ontario, the ODHA, the CDHA, and her local Dental Hygiene Society. After completing the dental assisting program in 1993, Michelle went on to graduate from the dental hygiene program at Algonquin College and is registered for self-initiation. Since 2013, she's held teaching positions at Fanshawe College and Western University in London. She's active in many aspects of the dental industry. She's a contributing writer for publications and helps develop policy for college dental programs. And in 2019, Michelle was honored with the CDHA Superhero Award. Michelle.
Thank you. Thank you.
It's a privilege to have you, so thank you for sharing your time with us. I'd also like to introduce Teresa Cullen. Teresa is a registered dental hygienist. She practices in orthodontic clinic, Janice Orthodontics, and has been at their clinic since 1999, 21 years. She's the health and safety representative and has an impeccable eye for detail. Having been in practice for over 20 years has given her a wealth of insight and knowledge about all of the changes that have passed through the dental industry. And she has also been an avid learner, doing CEs above and beyond what's required. And when she's not practicing or continuing education, she's spending time with her family. She has 3 boys and a husband at home. And your practice is in Windsor.
Yes, it is.
So you are one of the few Canadians who can say our neighbor to the north when you're talking about the United States.
Yes, we can.
Yeah. Welcome, Teresa. Thank you so much.
Thank you for having me.
Yeah. You're also, by the way, in one of the sort of, well, you're just across the bridge from Detroit, which has been was an epicenter of COVID-19 for quite a while. So you've had to deal with all of that, you know, being a border community, working in an area with maybe higher rates than COVID-19. And so I'm excited to hear how you've been navigating that and what it's like to be back at work. So welcome both of you. Thank you. So to start, Michelle, why don't you talk a little bit more about, I brushed through a number of different hats that you wear. And I think there were some recent ones as well that weren't included in that bio. You know, we were discussing a little bit before that you're also acting as a infection prevention and control expert in certain discipline cases for the regulatory body. Can you share a little bit about that experience and how that came to be?
Yes, absolutely. So yes, through the CDHO, many years ago, I used to be a CDHO quality assurance assessor, and I did the role for about 7 years, and it was wonderful. And I do like to share and tell people to encourage them to try and maybe apply to some of these positions that the regulatory bodies do offer, and you get to see a little bit of a different view of what happens on the regulatory side of the profession. So from that, I've always been in good standing, of course, with the CDHO. And yes, and I was approached a couple of weeks ago to see if I could be an expert IPAC opinion when unfortunately things don't go well and there's discipline hearings. My other two newly acquired positions is sitting on the board for the Canadian Standards Association and the International Standards Organization. And that came about on curiosity. I was bored, no, curiosity to find out how are the standards written. And right now for the Canadian Standards Association, we're rewriting or revamping the sterilization standards. So biological indicators, chemical indicators. So it's quite interesting to see how that comes about, how the standards then get taken, given to the regulatory bodies, and where public health obviously fits into the whole gamma of things. And the nice thing about wearing all these many, many hats is they certainly all come together. And Teresa and I were chatting a little bit beforehand. I'll often say that, well, I can't not practice what I preach. So if I'm going to be teaching it at the college or the university, then obviously I have to bring it into practice. And that part is quite nice, because when all the changes came about, say in 2017 with IPAC, well, not only was I writing courses about it, teaching it at school, I also had to live it. And then same with what we're sharing this evening with COVID, that it's one thing to talk about it, but when you're in the heat of the action, and it is hot with all the PPE, then yes, it's interesting how then you bring all those hats together, all that knowledge together.
Thank you. Yeah, it's certainly an interesting time to be an expert in infection prevention and control. I mean, this is, it's never been more front of mind and more essential to sort of every aspect of dentistry. Which is saying something, because it really has been at the core of what dental practices do, and for it to take on such an enhanced prominence now is really heavy times to be living in. So Teresa, you are the health and safety representative at Janice Orthodontics. Can you talk a little bit about the clinic where you work, your team, and maybe what it's like to be the point person for health and safety when all of PPE and compliance and infection prevention have been so topical and so important.
Sure. Being in orthodontics is a bit unique because generally people do seek treatment to improve something about themselves. It's very gratifying to see the transition from when they start their treatment to the time they complete their treatment. We see such an improvement with their self-esteem, their confidence. It's very rewarding to be part of a team that can so significantly have a positive impact on someone's life. Part of the health and safety team. It has been a wonderful experience. We have an exceptional team who are professional, respectful, caring, and proficient at what they do. And this combination has contributed to our successful delivery of care.
Yeah, that's great. Thank you. And something I've noticed working in the professions, that so often the point person for infection prevention and control and the point person for occupational health and safety in a dental clinic, it's very often a hygienist who takes on that role. There are definitely dental assistants, dentists who in their practice are the point person, but what I've noticed is quite often, if not the majority of time, it's one of the hygienists. Why do you think that is? There's a question for either of you to address.
I guess I could address it for Ontario, and I think other provinces as well, since we are, I'm going to say, held very accountable for our continuing education, for our responsibilities, and it is very well, like we'd say, embedded in the school when we go to dental hygiene school, that although even if you're not an independent dental hygienist, if you don't own the practice, you're still going to be responsible for the unfoldings of what happens in the practice. So I think because we have that sense of accountability and responsibility, and having to answer to our own regulatory body, that we kind of want to step in to, not even going to say have control over it, but be part of it. So then we know that the standards are going to be in place and be obviously fitting to what not just the dentist regulatory bodies, but the hygienist regulatory bodies as well. And then Ontario also has the lovely quality assurance portfolio. So we want to make sure we know the ins and outs of that practice as we're answering those practice profile questions.
You know, that's a great point. And it's certainly been interesting to see how in many of the provinces where the guidelines are not the same, that the Hygiene College has passed the more stringent or conservative guideline. And, you know, I think it you know, maybe it has to do with the kind of care being provided and the types of instruments that are being used. But certainly I think it reflects the emphasis that is placed on safety and on, you know, infection prevention. And you know, it could be a product as well. And this is, you know, going a little bit off script of just the fact that, you know, if you look at historically the people who have entered the professions, you know, a lot more women have entered hygiene. And I think, you know, an emphasis is often, you know, safety for women when you look at value systems and health and safety. And of course, you know, all healthcare providers, but, you know, I think there may be an element of that. And it's a good thing. It's forced dental offices to really, you know, raise the bar. And I think anything practice safer is good, as long as, you know, it doesn't put us out of business. And we can get into later maybe some of the tensions that have been going on in Ontario.
Yes, yes.
It's a prime example of a province where the regulators have not necessarily gotten on the same page. I think we can talk about that. So why don't we talk a little bit now, you know, it's August, we're going into September, you know, people are going back to school. We've been back to work for a couple of months, a few months in some cases. But I think it's worth just talking a bit about the roller coaster that has been 2020 in this profession. Both of you have been practicing for, you know, over 2 decades. So I don't know if you could just share a little bit about, you know, where we are now and what's sort of happened over the last 6-7 months in terms of what your practices look like. Professionally, you know, were you on lockdown? You know, did your practices close? How long were they closed? And what has it been like to reopen and get back to work under a, you know, quite different set of regulations? Teresa, I don't know if you want to talk a little bit. I mean, I know from the orthodontic perspective, there's a lot of interesting things that you know, I'd like to hear about, and I think our audience would.
Yes. So our office, prior to the shutdown, our practice principal is always on top of emerging technology to ensure our clients receive the best possible care. Coincidentally, in January, we had begun to offer a digital monitoring system. Initially, it was used for those Invisalign clients who either traveled a great distance or had difficulty getting time off of work. But this technology has proven to be invaluable during the varying stages of this pandemic. It allows us to monitor their progress. It allows us to have ongoing communication and reduces unnecessary office visits. We had been shut down for the duration of the period set by our guidelines. Our office manager and our practice principal kept in touch with the staff the whole time by doing Zoom calls on a regular basis, keeping everyone informed with what was going on with the latest regulations, recommendations, feedback from Dental Corp. And we did restart as soon as we were allowed to in June.
And were those team conference calls helpful for you? Just, you know, keep in touch with everyone and stay plugged in and sort of have a sense of solidarity. I imagine you're off, so it's work when you don't necessarily need to be working, but on the other hand, was it nice just to know what other people were up to and what they were going through and being able to connect?
Absolutely, absolutely. It just enforces that team atmosphere, right? We have a large team, but we have a wonderful team who work together very well. And it's good to touch in and find out how everybody's doing, because initially the recommendations were stay home, right?
Mhm.
Just stay home.
Yeah, stay home. Try not to worry about the worldwide global shortage of toilet paper, and find the best recipe for sourdough. That was pretty much April 2020. So, I'm interested to hear more about the way that you've adopted to remote consultations, and how the practice has, transitioned towards doing more teledentistry, teleorthodontics, and how you've been involved personally, and what patients' response to that has been like.
Yes, our office has moved more digital. Our practice principal and our treatment coordinator utilize the teledentistry by performing virtual consultations whenever possible. This reduces risk exposure by reducing the number of people in our office, and it has been very well received. In addition to that, with the dental monitoring, what that means for us in the clinic is we have staff members who will constantly check the dental monitoring progress and review that with our practice principal. When our clients do come in for an in-office visit, it's a few extra screens to have up on the computer, but it has been very manageable.
Yeah, so in terms of patients coming back, I'd like to talk a little bit what it's like, today getting back to work. And Michelle, I don't know if there's anything you want to add to what the last few months have been like in your life, and also whether your practice has been using more technology, teledentistry, and how patients have been adjusting to the added screening that Teresa was referencing.
Right. Yes, and well, during the time off, we were very active. We created a Facebook Messenger chat called our work family, and it was pretty much daily, and it was also during the day, but at different parts of the day. So we stayed connected quite closely. Our office manager was phenomenal at keeping us up to date and always letting us know if there was something else that was up and coming, some updates as well, because the office manager we have is also a certified dental assistant who was also playing a couple hats in doing some dental assisting work with the two dentists that were offering the emergency care and taking part of the teledentistry screening. And then upon our return from a technology perspective, we did continue with the messenger system internal within the office, and it does save time. It does save us from traveling, of course, through the office. And now when we need the dentist for a recare exam, we don't have to get up. Our past system was getting up, writing a little paper note, going to drop it off, which was kind of fun. You got to see your coworkers a little bit. But now obviously we can do all that through Messenger. And it's worked out quite well. I think it keeps us connected even throughout the day. Or if you have a client and you have a question, you can quickly send the dentist a message. So obviously it was always there for the taking, but we had never set it up because we obviously would just get up and go do it. So I think that's helped. And for the clients, one thing they do like is through the screening is that they can answer the main screening questionnaire online. It gets printed up at our front desk. They like that. They like that it's a little bit more interactive for them. So I think it's been nice. The one thing I did notice today, ironically enough, my last client of the day, as I'm reading the notes from the last visit was in February. The last thing at the bottom of the note said, screened for COVID-19 has not traveled outside the country. And I thought, in February, that's all we were asking, right? Have you traveled outside the country, right? So
Right, we didn't have it here. At least that's what we thought.
yeah, exactly. So obviously, yeah, to see that today, I thought, how ironic that good that we were obviously on it come February, and then how much obviously it's evolved in just the screening in itself, right?
Yeah, now we're asking people like, can you smell this? Can you do that? There are so many questions, so many changes for teams, so many changes for clients, patients. You mentioned before that it's a hotter now with all that PPE on. So I'd be interested to hear from either of you how you've learned, if there's anything you've had to adjust in terms of your scheduling. Do you schedule more time to don and doff? Do you find that you're taking longer between patients to turn operatories over? I know, ortho, some of this doesn't apply quite the same way. But just, how is your day-to-day different now? Aside from the screening questions and the information, just, are you using your staff room, your lunch room the same way you used to? Like, what are some of the ways that the ebb and flow of a day in the dental practice has changed for hygienists?
Mm-hmm. I guess I could say, well, when we arrive, I'll start on the arrival. So the arrival is much sooner than prior. I do hope people weren't arriving just 10 minutes prior to the start of the shift, right? But yes, arriving earlier. And I would have to say that the adjustment is also in the record keeping, where a template, revamping the template so that it prompts you maybe as a checklist as you're going along, and also includes everything from the regulatory body's perspective, that a safeguard. So a checklist, a chart entry that is very precise and meets the standards. So I think being prepared that way is wonderful. And
what have you added to your template? What's about your template today than 6 months ago or 7 months ago?
So the template now has a section on COVID. Mm-hmm. It'll say, and we can actually copy and paste. We use a Dentrix software. So the front desk, the administrative team, will have pre-screened. They'll have written wonderful notes in our pre-screening box. Mm-hmm. I copy and paste that, bring that into our notes, and I find that's a good way to do it. Then we've certainly proved our due diligence of what happened in the pre-screening. It even has the date, the person who did the pre-screening. Then I move on to the outcomes of my screening, as well the consent form and where they'll be found in the digital file type of thing, their temperature, their medical doctor, obviously we would have had that prior, and yeah, more of a revamp, also a section on a disclosure saying that, for example, my room is operatory number 1, so I say operatory number 1, adhere to the fallow times as per protocol of Southwest Dental Care. Mm-hmm. At the end of my entry, in the past, I was writing, client arrives and departs in apparent good health. And again, today I'm reading that, and I'm thinking, well, that's a very important one to make sure to include, as mm-hmm. I like it as the last entry, because the last time I had contact with this patient, yes, they were in apparent good health. And then obviously from there, whatever would unfold. So yeah, the chart entry is a little bit different. Obviously a bit more on the screening, as we were saying. Mm-hmm. So setting yourself up for your day ahead of time is going to be the key element. Mm-hmm. Then you're not worried if you've missed something. So clinically, obviously having your instruments ready, having your instruments sharpened ahead of time, obviously makes a big difference. Maybe even little tips like we were obviously needing to use our high volume evacuation system more. And we've cut our high volume tips. So we don't have the tipidilly that's already bent. We have the straight stick. And I found that if I cut them ahead of time in the morning for the many that I will need, I'm also prepared that way. And then I think as well, our team huddle has changed. Before we used to all meet in the staff room and, sip on our coffee, tell some bad jokes, maybe eat butter tarts we shouldn't have been eating first thing in the morning. And yes, and then have our morning huddle going over all the needs of clients, where we're going to be needed, highlights potential issues with scheduling. So we're still doing that, but on a format through our messenger. Mm-hmm. So how does that make us feel? Well, we do like one another. We have a solid team, and we do like spending time with one another. So we kind of miss that personal touch, but we haven't lost the client needs perspective. So that's still being met, which I think was a very key element. In this office, we've been doing morning huddles now for about, 24 years. Wow. So it's part of our whole culture and our whole dynamics in that office. So when we had to walk away from the staff table, that was a little hard, but that's okay, because now we've got our virtual platform to do so.
Well, that's great. Yeah, there've been so many changes, but what's interesting is that, despite having to physical distance and social distance from your teammates, that in a lot of ways, the level of communication has either remained the same or even got better. Mm-hmm. And that's, I think, a legacy, hopefully, a positive legacy that COVID-19 will leave us all with. And I'm interested, I was interested to hear about some of the things you've been doing to manage, aerosols. So high volume evacuation is so important, and it's something that is, universally recommended by the regulators. One of those few things that's just across the board been endorsed by, public health, the dental regulatory authorities and hygiene regulatory authorities. So it's important to have those tips and tricks and to share them. And the research says that between 90 and 97% of aerosols reduced just using an instrument that's always been there. Hasn't been as important or central to the care. So really interesting and great tips. I'd be interested, Teresa, at a busy orthodontic clinic, you obviously had some unique challenges to deal with. I imagine, some of the chairs at least are open concepts. And then how have you managed to continue to provide care and during that period of time, where dentists weren't doing any aerosols in open concept areas under the, RCDSO's guidelines, how did your office adapt to continue to provide the care that needed to be provided?
Yes, so we did have to adapt some of our needs. We are open concept, and initially we were not doing any aerosol performing procedures. So we had adapted some manual techniques. We have changed some of the products that we use. And since then, we have outfitted our record rooms with high-speed capability. And we have been able to schedule those aerosol procedures in those rooms. Yes.
Yeah, no, that's great. And it's really, that ties in, it all ties into what you're talking about before of doing a lot of the monitoring remotely, right? And doing some of the consultations remotely. So finding ways to reorganize the care without sacrificing the patient experience, and things that would have been done in the records room or done remotely with confidentiality, but you're still connecting with the patients, and then using those areas when necessary to do the aerosol procedures. So I think it's really interesting, and it's it shows you that there's no one size fits all. You have to know your team. You have to know the care that you provide. You have to know the clinic that you have, and then you have to be creative, right? You don't usually think infection prevention and control or regulatory compliance is a creative exercise, but it certainly has been over the last 7 months, and I think it's been done well. And it's, we've had a success and luck across our network in Dental Corp, that we've stayed safe. We haven't had any cases of outbreaks or clusters or contagion, and touch wood that we continue to do that. But I think it's not just rigor and discipline, but there is a big component of creativity and thinking outside the box that we've had to do. But it hasn't all been, a huge success. I think we have to recognize that there has been a lot of stress and anxiety, and partially because of my position at Dental Corp, where I hear about a lot of the issues that arise, being the compliance and the risk point person. I'm interested to hear, how have you developed any strategies to cope with your stress personally? And have you had any difficult patient encounters or just encounters with patients who are anxious or needed some additional reassuring?
No, and that's a very good question, because we're trying to, whatever that we learned while we were at home, so all the research, all the reading we were doing, then we eventually had to bring it into clinic, right? So I always joke around and say we can't park our knowledge. So we've read all this, maybe we attended, there was a lot of webinars, and of course DCC was amazing for providing all these terrific resources. And you're right, then it's showtime, where you're at the clinic and now it's going to have to happen. So mentally, how do you process that? And we've all seen those t-shirts. They're usually the t-shirts for dental hygienists when they graduate. And there's going to be a list of everything they do. And at the bottom of the t-shirt, it says, yeah, I clean teeth, right? And I always think that. I think, well, before you even pick up a scaler to clean teeth, I've actually counted it. There's about 23 steps. In order to execute those 23 steps, I think that's a huge mental checklist. So in coping with this, I think we had to adapt our mental circuit. So really adapt it. And we do our jobs so well. We're professionals. We know the job like the back of our hand. And it's sometimes challenging when you have to go back, revamp your mental circuit. So instead of doing this, I'll do this. Oh, in between here and here, I'm going to sandwich this. So it has been interesting. And I think maybe it's also looking at it as we're going to see these changes. So are we accepting it as a wonderful challenge to rise above, or will you let it defeat you? And obviously you cannot let it defeat you, because that would mean that you're resigning from the profession that you worked so hard to be this registered dental hygienist. So then the other option is to rise up to that challenge. So you pose a good question that, yes, there's the physical part of the job, but it's almost as if there has to be that connection with the mind that you need to tell yourself, okay, here's what I'm going to do. I've got this. And do we drive to work or walk to work, whichever your method of transportation is, and try to coach ourselves? Oh, yes, every day, right? And yes, we do tell ourselves, yeah, I got this, I got this. And we do that also to our team. So as Teresa was saying earlier, the team presence is even more important now than it really ever was, so that we can support ourselves with this stress. And to be able to come, out of your operatory in social distancing and be able to say, okay, well, this happened. How can I do this differently? How are you doing this in your operatory? And I think the talking through is a big thing. Yes, we can be our own cheerleader and, try and motivate our own selves. We have to motivate one another as well. Otherwise, you're right, it will be a hard road. And I do think that dental hygienists, any dental professional, we're a little OCD. We like structure. And now we've been asked to unstructure everything we had and revamp it very quickly. So that makes us feel very uncomfortable. But I think maybe as we realize, as time progressed, we've become a little more comfortable in our whole situation. And as we were speaking, when we were doing our planning meeting last night, and I shared the one humoristic thing is that we also have to laugh along with these changes. So I remember the one day putting all my PPE gear on, and then I've got my shield on, and my shield sits probably right about here, I guess. And now I'm having to turn, and I'm just thinking, okay, what's my next step? Did I put my PPE on well? Is my sequence fine? Was the patient watching me? Am I thirsty? Did I drink enough water? Right? So all these thoughts are going through your mind. And then as the mental circuit is happening, I turn my head, and I was hitting the patient in the head with the bottom of my shield. So there's the mental circuit adjustments, there's the physical adjustments. So then, of course, at that moment, it could be defeating, but we have to really go on the side of humor, right? To say that, you know what, we apologize. I was joking around with the patient saying, I apologize for my violence. I promise your next appointment won't be as violent, right? And I think that worked. So realizing that, you know what, our first couple rounds of this may not be the perfect circuit we had, but we'll get there. We'll make it happen.
I couldn't agree with you more. Having a sense of humor is so important. And I don't think I've heard that mentioned really by anyone. And I've been doing, you know, a lot of these webinars and reading a lot, and I'm reading the news and the media and, you know, dental journals about how to handle COVID-19 and how to adjust your practice. And nobody's saying you have to remember to enjoy life.
Absolutely, exactly. And within the team, we've got some funny little lines that we realize now. The operatory that I'm in, we had, well, it was like a maze. There were 3 entrances, so we had to block them off. So it's very attractive from a decor perspective. I look like a construction zone with plastic walls. Now the main entrance is a zippered wall. So I will often say to the clients, well, I'm welcoming you to your camping hygiene visit, right? And then as the dentists come in and out, if they're coming in to do a check, we'll say things like, oh, make sure to zip up the door. We don't want to let the mosquitoes in, right? So I think that also alleviates that the clients are seeing all these changes, but obviously it brings the level down to more maybe adaptability, right?
Yeah, that's a great tip. And I think, you know, a lot of people are wondering, how do I calm or relax my patients? And sometimes just, you know, be yourself, tell a joke, laugh, and forget all of the concerns that they had a moment ago. You know what I mean? And so just staying present in the moment and seeing things through the patient's eyes. I think, you know, it's your day job, right? And you know, Teresa, Michelle, you have like that checklist, a million things to do. You've got to do it in the right order. And it's very easy to get sort of solidified in your experience and forget that the patient only comes twice a year, maybe. And for them, coming to the dental office is an entirely different experience. And just taking a minute to remember where they're coming from, or I guess, Teresa, you know, in ortho, again, you see your patients a little bit more often, but just the same, you know, it's an event for them, and remembering that and being able to connect with them. So like your camping hygiene experience plays dynamic really, really well. I like that. And another tip that I can provide, you know, based on some feedback I've gotten from offices is, you know, recently a patient was at a hygiene visit and they came in anxious and nervous. And there was a TV playing. I don't know if either of you have, you know, TVs in the operatory area, but there's a TV playing, and the news was on. And I don't know, maybe the previous patient requested that the news be played. But on the news, there was a teacher up there from a union, you know, saying, you know, COVID, 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 and we can't go back to school, and we're all going to get sick, and COVID, 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 and you know, so you're trying to relax the patient by having your camp appointment, and this poor patient sitting there, like, you know, hearing hysteria, like the worst thing. So just be aware, like, again, when you're, you know, the hygienists I've known, they get so absorbed in their work because they care about it and they want to do a good job, and they're so focused, they probably don't hear what's on the TV.
Good point.
Yeah, but the patient is absorbing all of this. And so again, just, you know, stopping for a minute, putting yourself in your patient's shoes, I think is really, really helpful. And, you know, maybe it takes 10 seconds to take a deep breath and just say to yourself, imagine what this looks like through the patient's eyes. It helps a lot. We have a question in the chat. So I thought I'd put the question to the two of you. Do you have sample documentation that's written which you can provide?
Oh, yes, absolutely. So if you would like a copy of the template, absolutely, for sure. Yeah, we could certainly provide resources. Absolutely.
That's brilliant. Yeah, so we can circulate something to the participants afterwards, and we can work with our support teams to get that out there. So, Nishad, good question. Thanks for asking, and I think that that'll be something useful and tangible for people to take away. Teresa, you have, I imagine, a lot of children in your clinic, and I imagine as well adults. Can you talk maybe a little bit? Have you noticed a difference about how age might influence the way people view coming back to the dentist, or levels of stress and anxiety of the patient population?
We actually see a wide range of ages, so not only children, we have many adults in treatment. They have been very pleased to return to the office. They are excited to complete their treatment. As you mentioned, we do see our clients more often than a general practice would. We see them every 6 to 8 weeks, or possibly sooner if they have an expanding appliance. Prior to their appointment, our receptionist, when they book the appointment, they will thoroughly review the arrival procedures with them. So when the client arrives, they know what to expect. And I think that helps to alleviate some of their fears.
Yeah, absolutely. Yeah, just the added contact points can make all of the difference, right? So orienting your patients just so they know what things are going to be different, but you're going to be prepared. You'll know by the time you get here what that's going to be like. So in terms of how you orient your patients, in addition to the call, who tends to greet the patients at your clinic? So do you meet them at the car? Do you meet them at the front door? Do you meet them outside the clinic? How does that flow work? That's something I'm very interested in. And I think, that's that first impression, even though the patients may have been coming, they're coming back now, and that's that new first impression you're setting. So how have you managed that, Teresa?
So at our office, we are texting. So when the client arrives, they will text that they have arrived. The front desk will check them in, and from the clinic, we can see that they have arrived. When we're ready for the client, we'll then text them directly and let them know they are to come inside the office. We meet them in the waiting area. And the clients and caregivers have been very cooperative and very respectful of our new normal. Oftentimes, only the client will come in, and we have 2 screening sessions set up, and the screening will begin, and provided that passes, they proceed into the clinic for their appointment.
Yeah, that's great. I love the texting technology. As much as the dental waiting room has been such an important part of, historically my experience at the dentist as a patient, was never my favorite part. So I think this is another, it was by force, not by choice, but I feel like these added elements have really improved the patient experience in some ways. This is like just in time sort of welcoming into the dental office. And, and you're really, there's an element of special attention, I think, that patients can receive now. I'm coming out to meet you, like where somebody is greeting you, you have a greeter that, before it might've been you come in, you sort of say, hey, I'm here, you sit down, and then, you wait your turn, and maybe your dental office is running behind, maybe it's not. But now it's, somebody says, hey, welcome, we've already been texting, I know you're here, we've looked at your screening form, I'm gonna make sure that it's okay, you signed your consent, great, you're ready to come back. There's a level of attention that we should emphasize, and I think that we can use to show the patients that dentistry has never been more patient-centered than it is now. We're, with these different methods of touch contact points, technology, et cetera. So I think that's really neat, interesting to think about how we can continue to use this, you know, in the future when maybe it's not necessarily required. We have a couple more comments. One is a second person is requesting those chart notes. So yeah, I think sharing a template for hygiene notes is going to be a popular idea. And then we have another question from Anna Volpe.
Oh, hi, Anna.
We all know Anna.
Yes.
Anna would like to know what is the purpose of cutting down the suction tip for, I think, the high volume evacuation?
Ooh, yes, good question. So it came about that, obviously, as you are using your, well, whichever right-handed or left-handed, I'll say your suction hand, as I was coming around to hold the high volume in not having an assistant, obviously being a one-man show, as I was coming around to hold it, I was finding that because the tip was so long, pretty much almost the length of a pen, my ergonomics was being challenged. And really, in order to be able to retract, to be able to get closer to the tooth and really zone in on capturing the aerosols with the beveled end of the high volume evacuator, we would have to really hold it down here closer like a pen grip. But I couldn't do that because my hose and the angle is over here. So I was finding that I had to hold it halfway, bring my arm like this, so ergonomics wasn't working. So then by simply cutting it in half, I'm now able to bring my arm down, hold it like a pen grab, and at the same time, retract. It made the world of a difference. And I simply cut them with a pair of scissors. And then obviously it's not contaminated, as the end that was cut will actually go into the actual holder for the suction. This is an area we could save some money because now my suctions will last double, right? But it really did make that difference. And now I am able to control the aerosols better. I feel better that I am controlling the aerosols, and I don't have the cord lag either, bringing the tip down. So ergonomics wise, made a big, big difference, absolutely.
So we have two questions that follow up on that. One is the ergonomics, it's a bit of a comment, but I think it's worth discussing. The ergonomics with the HVE is so hard, that shoulder is getting sore. So I would like to talk about ergonomics. Maybe both of you, you've been in the profession a while, you know, you've been through changes before. Just talk a little bit about, you know, what you've noticed different about your posture, about your positioning. You know, that point of holding your hand like that is such a big change. You might not notice it, but, you know, after a few days, after a few weeks, after a few months, that shoulder, your neck, your back, your whole body's connected. And we don't want anybody to be on, you know, disability or to shorten their careers. What can you do to check in with yourself to, like you said, cutting that tip was ingenious, you know, that's a tip that some people can use. Are there any other tips you have, you know, just about personally making sure that you're not doing any harm to yourself because of the changes of, you know, PPE you're wearing or the tools you're using, or hand scaling is another one that's a big change for some people.
And I did see in the chat, one of the questions that came up was about the suction hose. And yes, indeed, they can be very heavy.
Yeah.
And the irony is, right before COVID hit, I had one of the old suction hoses that was in a spiral shape. And every time I look at it, I think, well, this is potentially an IPAC issue, as this is very textured. So we actually had the hose changed to one that is much lighter, one that is more rubbery, if that could be the term used. And we actually extended the length so that I didn't have to feel as if I was always being tugged back. So we have it a little bit longer, and I do sometimes rest the cord, but off my elbow. And very similar to what we do with our ultrasonic, with the, obviously your ultrasonic hand, where we rest the cord maybe on your forearm. So then you're able to do that now if your cord indeed is lighter. And you're absolutely correct, whomever asked the question. If you have one of the older style cords that's rigid, impossible. And it is impossible and frustrating. So remember how earlier we were talking about accepting the challenge or defeat? that suction hose is enough to make you want to throw in the towel, right? So something as simple as that, and you're right. So the different material and maybe the cord being just a tad bit longer made a world of a difference.
That's amazing, really helpful. You know, you wouldn't want to sacrifice the morale of your office or your ability to work full time for, you know, a few inches of hose. So I really appreciate that, and you know, I can see by the comments coming in that this has sparked quite a bit of thought. So a couple more questions. In terms of the tips, so what kinds of HVE tip are you using? Have you experimented with different kinds? And you know, any experience you have on that might help. So I think a lot of people have been wondering what's the right way to do HVE and to do it well without injuring ourselves.
No, correct. And you're right, the traditional, well, if you have the Tippedilly HVE, it's nice because it obviously is shorter, already has an angle. So that's super helpful. If you have just the straight one that, like we're saying, you can cut, it does have a bevel on the end, but yes, again, depending, like we said, on the cord, how you're going to maneuver. There's some wonderful things that have come out. The one suction or the mirror that is attached to the high volume, that tends to be nice as well. Now, I haven't gotten my hands on one of those because they're all back ordered. I have, however, had a chance to work with a company that does the Ergo Finger. It is a company from Finland, and basically it looks like a finger sling, as if you've injured your finger. And that goes, obviously your finger goes in it, and then it also holds your high volume. So you are able to move your hand freely without even holding the high volume because it's attached to your finger. So there's some unique things out there, and you're right, asking these companies for samples would be the keynote, because I certainly wouldn't want to order a whole box of anything and then find out it wasn't quite what I was looking for. So obviously we all have the HVE, regular HVE in our rooms, and could I say, does it work and does it work well? Absolutely, once you've got that shorter tip. So there's a lot of wonderful things to try out there, but some of them might be a little gimmicky as well, if that could be the word from the product perspective.
Absolutely, yeah, there's been no shortage of innovation in the dental space over the last 6 months. It's been an explosion of innovation, but you know, not everything has been maybe as quality as other things that have come in. So yeah, so this has really generated a lot of interest. So in terms of the Ergo Finger, where would you order that from?
Oh, wonderful. So we can certainly connect at any time. And yes, and you can order directly from the company, Ergo Finger themselves, and they send out a sample kit that has, oh my goodness, I think 100 tips to use. It's phenomenal. And it does not come with an attachment for your mirror. However, I have mastered using the mirror with it. So you can hold it with the mirror and get wonderful, wonderful results. And it is not bulky either. So yeah, it is worth trying.
That's great. Super interesting. So I don't know if either of you can answer this question. You know, high volume evacuation, high volume suction, everyone is supposed to use it all the time. It's, you know, one of the best remediation measures for reducing aerosols in the environment. It's, you know, capturing these fine mist particles at the source, makes tons of sense. But on the other hand, you know, low volume suction in some cases is considered faux pas or potentially even adding to the aerosols. I'm not sure, you know, I know you do have expertise in IPAC. Do you have any insights into why the difference between low volume and high volume evacuation?
Oh, good question, yes. And I could certainly find the study. Dr. John Molinari has an article where he does describe different adapters to all these suction potentials. And yes, from the aerosol perspective, would be simply because of the opening of the HVE. Even just your normal HVE will be 8 millimeters. But when you're looking at the saliva ejector, it wouldn't have enough pull, and obviously the diameter of the opening would be too small. Now, the one neat thing though about the saliva ejectors is you can also adapt them to, I think there's one called Mr. Thirsty. There's, I believe, Relief as well. They would really work together. So what I've been finding is I'm having the clients participate. When I'm needing to use the HVE, I'm getting the client to hold the saliva ejector. I'm positioning it where it needs to go. People are fine with it. I'd rather do that than dangle it from their cheek, right? I don't think that's too comfortable. But yes, it would be a layered approach. So if we were to look at saliva ejector, HVE, where did they fit in? They could work and coincide together, layered together. But you're right, the slow volume does not have the diameter to pull the aerosols through, nor the power. So good question.
So it could almost, it's counterintuitive, but it could almost make the situation worse because it's moving things around, but it's not capturing them all. Yeah.
Exactly.
So there's been a flurry of questions since you talked about I think the HVE and the ergonomics and making these adjustments to your practice has struck a nerve. And I think that's important. So one question we have from Sheena Burgess is, how do you cut the tip? So I think she's picturing cutting it and then the tip goes flying and then, you can't very well use it when it's sort of bounced across your operatory a few times. But
yes.
Have a technique to keep both sides from...
And a very good question, because that's exactly what happened, right? And luckily I'm in the operatory by myself, but yes, one did go flying, ricochet off the wall and came back and hit me in the side of the head.
Okay.
There we go. That was my karma for hitting my own patients in the head with a shield, right?
It's a learning process. It's a learning process.
Exactly. So what I actually am doing is a Ziploc bag. So I do keep my Ziploc bag with my scissors, and first thing in the morning, I throw my my HVE tip in there, place my scissors in, and not a little Ziploc bag, but the big freezer size or even the medium. And then when I cut, then obviously it can go flying all at once. And then obviously I'm not going to waste either, because the first time I did it, both tips could go flying and you're left with nothing. So yes, putting it in the Ziploc bag, and you're actually able to maneuver the scissors. And basically what you're trying to do is get the tip right at the end of the scissors and kind of push it back and forth. Eventually you've got enough of a cut that you can take it and snap it. So I also learned the lesson, don't cut the whole way through. That's when it's going to take off on you, but enough so that you've got a serration in there and you can snap it in half. So it's ideal to get them ready ahead of time. See?
I think that's maybe the thing that people take away the most is just this whole tip. Who knew? We could do a whole session.
Yeah.
tips. So it's almost 8 o'clock. There's a couple other things I'd like to talk about, though. And Teresa, I'm curious to what your experience has been. Recently, the WHO, the World Health Organization, made this announcement that everyone should avoid non-essential dental care. And then obviously, our local dental associations and dental hygiene associations clarified that, for the rates of transmission in Canada, the guidance didn't apply to us. It was more towards these sort of global hot spots. And I can understand that, certainly. But, in terms of, have you noticed a pullback or a slowdown from your orthodontic patients? Or are you still seeing new case starts and, are patients happily coming to the appointment? I'm just curious to know if patients have been absorbing all of this noise as well, or if they're sort of eager to carry on with their care and to get the smile that they've always dreamed of.
Yes, we do still have the patient starts. We are fortunate to have clear, concise guidelines to follow. And these guidelines that are provided to us are living documents.
Yeah.
So as more information becomes available regarding the transmission, these can be updated accordingly. So I feel to date they have erred on the side of caution, which in turn provides additional protection for both us and our clients. And it is important that we continue our ongoing diligence with infection prevention and control. And I think by doing that, our clients do have comfort in continuing to come to their visits.
Yeah, no, that's a great point. And, by being, that little bit extra cautious and by internalizing, instead of sort of maybe complaining or worrying about all of the guidelines, really embracing them, what it does, I think, is it gives the staff, the team, the clinicians, a sense of confidence that they know that office is one of the safest places they can be. And by just embracing all of these, heightened guidelines, when your patients come in, you can really share with them your honest, authentic feeling that, yeah, no, it's a safe place to be here. And I think that rubs off on the patients, and they'll leave feeling the same way. It's, I can come back, whether it's elective or urgent or essential. I know that going to the dental office is one of the safer activities I can engage in. Nothing is 100% safe, but I think that's absolutely very true and a very good point. So we have a few more comments about HVE tips coming in here. So one, Bernice Ong says, you can cut the HVE in half, and now you have 2 pieces for 2 clients. So I think you had mentioned that much saving money. So which is brilliant. So I don't know how we just saved clinics, but it's added the value of tuning in. And Haley Soar says that there are adapters for the HVE that enables the attachment of the slow tip. Do you have an opinion on that?
I'm wondering, I know that there's one. Is it the one that is a mirror? There's a mirror, which is a mirror head. To the mirror head are 2 attachments, and you could clip on to, first they were manufactured for the saliva ejector, then now they're also manufactured for the size of an HVE. So yeah, the Hagar mirrors.
Yeah.
Exactly. Yeah, exactly.
Okay, and then somebody's saying PureVac is.
Oh yes, yeah, and the PureVac is nice as well because you've got your circumference of the mirror. Around the mirror, you have a whole bunch, I'm going to call little holes, and that's where your suction is coming from. And that's the one that, yes, all back ordered. And we haven't been given a date either as to when the back order is. Yeah,
that's, well, at Dental Corp, we have a procurement team, and I know that they have been looking into, 6 or 7 different HVE solutions, and many of them are back ordered. And for a lot of hygienists, it's their first time using them, and so they're not ready to order a year's supply either.
No, exactly.
They want to test drive these things, because they order the wrong thing and then it's not comfortable for the way that they tend to practice. Then what do you do with that? So, we've gone beyond an hour, and it flew by. I just wanted to wrap up. I think we may have to do a whole FAQ on HVE. It looks like the continued interest coming in here in the comments. But Teresa and Michelle, thank you both so much for your time, for your insights, for sharing with us your experience and your tips and tricks for how you've managed to return to practice and stay positive and keep your sense of humor and stay focused on providing patient care and therapeutic benefits to your patients, and using that as a way to not get caught up in the anxiety and the stress. And you both have very, very calming demeanors. So your patients are absolutely lucky to have you as providers. And so, on behalf of Dental Corp, I want to thank everyone for tuning in. If you found this interesting and insightful, let us know, and we'll try to put out some more content for the hygiene community out there. There are over, 1,000 just in our network, or maybe 2,000. And such integral, important parts of the dental community. So thank you all. We'll remember to circulate a template, and the compliance team will comment too. Thank you, and have a great evening. Teresa, Michelle, is there anything you want to say in closing?
Thank you very much for having me. It was very nice to meet you, Michelle and Julian. Thank you.
Yes, thank you very much for the invitation, and likewise, Teresa. And I think to everybody that's listening, to remember to trust in yourself. Trust in the knowledge you have. Trust in the fact that really you can simplify our changes by thinking we've already been doing so much with infection control. All we're doing next is adding a few extra layers. You've already got the base. And to remember that your confidence should come from the fact that you know what you're doing. Absolutely. So to continue being amazing as professionals. So thank you, everybody.
So true. Thank you, and have a good evening, everyone. Until next time.